everybody to our second Friday forum run by Healthy Cities. And today is going to be a little bit of fun. I'm joined by two amazing colleagues who I'll introduce in a moment. But just firstly, I'll be a bit distracted as I let people in to get started. Firstly, just like to acknowledge the traditional owners on the lands in which we meet today, where most of us are probably calling in from Dharawal country. So just pay our respects to elders past, present and emerging, and anyone Aboriginal joining us in the webinar today. If I just share my screen. And hope everyone can see that. So welcome once again. Okay, the Friday Forum number 2. You can't ask that. The pandemic uncut. I'm first of all going to hand over. These are my colleagues. I'm getting very distracted letting people in here. So obviously I'm Kelly from Healthy Cities. We've got with us Toby Dawson, who's the Head of Strategic Partnerships at IRT, and Michael Chapman, who's a Health Policy Officer at the Ministry of Health, and he's also his own kind of legendary self, Chappo Health and Nutrition. So I will stop sharing. Toby's going to start to share his screen. We're going to kick off by just, promoting the local Vax Illawarra campaign, which is really important that people are aware of that. So we'll kick off to Toby now, and I'll stop sharing.
There we go. What did we do before we could share screens? Thank you very much, Kelly and Healthy Cities Illawarra, for hosting the Friday Forum today, and also for Chappo coming together. We go way back, spent too much time at the uni bar when we should have been doing uni work, but that's a different story. Today, I'm part of IRT Group, as Kelly mentioned, but I'm representing the Vax the Illawarra campaign team. I've got a bit of information around the campaign, so I think it's a really cool public health initiative, and also it's really important for our region. But I'm also conscious, I've got a lot of information, so I'm going to move fairly quickly, because again, I know what it's like to be on the wrong side of Chappo, and he'll give me the hurry on if I take too long. So really, I hope that you'll help join us in the Vax Illawarra campaign to hit 80%. And for this campaign, the Illawarra is the 4 LGAs of Wollongong, Shellharbour, Kiama and Shoalhaven. We know that the ongoing restrictions are hurting small business, retail, tourism, families, individuals, communities are on their knees. You know, we've had these restrictions going on for a long time, and we've heard the Premier speak of a target of 75 to 80% vaccinated. So that is our guiding light. That's what we're shooting for. We've now got a mass vaccination hub, which is the old DJ's building in Wollongong, but we also know 2/3 of vaccine is being supplied or provided by GPs and pharmacies across the region. So what we're trying to do through the Vax the Illawarra campaign is get people active and get them to commit to getting their vaccine. So what are we actually doing? We're bringing the region together with a common goal to be the first region in Australia to hit 80%. Now, we're aware that there's some individual LGAs that are out in front of us, but as a region, the Illawarra is very strong. And we know that we rally together. We can be somewhat parochial at times. So this is really trying to harness that to get a really good outcome for our region and community. So it's very heavy with media being led by the Waples team, but we're also following that through with a below the line campaign focusing on social media. The overarching strategy is to connect people with the cause, with the campaign, engage them with the actions that they can do, and also educate them around what the vaccine opportunities are and what the benefits come from that. And again, I thank Healthy Cities for this forum and the opportunity to share Vax the Illawarra, because it is part of a public health approach. Now, any of the public health nuts that are joining us today will surely recognise this image from the Ottawa Charter for Health Promotion in 1986. I think if you look at the middle of the of this image, where it's enable, mediate, advocate, that's very much where the top-down messaging from our government's been coming. You know, they've been working hard to reorient health services, and I think they've been hoping, you know, a little bit that it would create supportive environments, development personal skills and strengthen community action. So that's been the top-down approach. What Vax Illawarra is trying to do is actually trying to drive the bottom-up approach, because upstream is just as important in this initiative. So we are really looking to strengthen community action. By doing that, we're really looking to develop the personal skills that people need to take action around the vaccine. That will in turn create the supportive environments. And, you know, it might be a stretch, but we may reorient those health services. And I know there's great work happening from groups such as Community Industry Group, Coordinaire, organising pop-up clinics for exactly that purpose, to make sure that this is available and accessible for everyone in our community. So what we're doing is we're looking to motivate people to do the right thing. The state and federal governments are looking at the big picture, but we need that local messaging to resonate with people in our communities. And that's what Vax Illawarra is doing. We're filling that crucial information vacuum locally. What we're doing is we're working with business, community, religious, Indigenous leaders, music and entertainment personalities, sports personalities, all around spreading the message to Vax Illawarra. And we're doing that very much through an ambassador-led campaign. So we've got, as you can see there, a list of names, all really well known from throughout the Illawarra region, from all different walks of life, who want to see us get vaccinated to end the restrictions for a number of different reasons. I think one of the big wins for this was that we have two of the most successful sports stars internationally from Wollongong putting their name to this. And they were the co-captains that launched this at the end of August. So Emma McKeon, our most medalled Olympian and the fastest female swimmer on the planet, and Alexander the Great Volkanovski, the UFC featherweight world champion, were without hesitation right behind this campaign. And in fact, other than a short piece at Sydney Airport, Vax Illawarra was the first piece of media Emma McKeon did after the Olympics. So who is involved in this? In all of the campaigns I've been involved in, I have never seen such collaboration and support from right across the media spectrum. We've got all of the media players within the region sharing content, sharing information, all working together to Vax Illawarra, and I think that's a massive win. We've also got a huge range of partners. So these are people that have financially contributed to the campaign, because as much as it's being driven by people power, as much as it's being driven by a lot of goodwill, there are some hard costs, and it's great to have those organisations, again, who want to see the vaccination rates go up so that we can return to some sense of normality, but also their businesses that have gone all right during the lockdowns and the COVID pandemic. How are we doing it? Well, we're doing regular content to media newsrooms. You've probably seen, if you follow the Mercury, again, massive shout out to Kelly and her family, who recently did a piece for the Mercury around Kelly's kids willing and able to get vaccinated. There's a lot going on with Win News doing pieces, ABC Radio, I98, Wave FM, lots going on in that top line media space. And again, to support that, we've got a whole heap of creative campaign resources. So there's creative content, I'll show you in a second. Media, as I mentioned, the website vaxillawarra.com.au. I recommend you go and have a look. It shows you the vaxometer, so we can see how we're going in tracking towards that 80%. It's also got a link there that you can click, Vaccine Finder, and that will show you where all of the vaccine supply is available locally across pharmacies, GPs and mass hubs. And you can also click on another button to book straight in with GPs through hot docs. Ambassador videos, spokespersons, and so on. So you'll see some of this creative go around. You can access this from the Vax Illawarra website, so it's social media tiles, as well as email footers. And again, I'd encourage each of you to visit, download that pack and use it yourself, because we need to get this message out from all corners of the region if we're going to strengthen community action and drive up vaccine rates. So messaging, this is a really important piece around the campaign that I'm again quite proud of. We've actually stratified the different subsets of our community, realising that different messages are required to resonate or engage with different parts of the community. So we've got to have a different message for our Aboriginal brothers and sisters versus what we need for the Arabic-speaking Lebanese community, which is different to the sports lovers that can't get back to their sport, or the young kids or students even trying to sit their HSC. So we've worked with those different groups of our community, identified the message that we want, and then also followed that up by getting an ambassador that speaks best to that relevant message. So when will we do it? Obviously, this slide is a bit outdated because we did launch on Friday, the 27th of August, but it was intentionally drafted into two stages. One, getting people ready and prepared to take action, knowing that we had limited supply. But as of Monday, the 20th of August, we are getting double the vaccine supply into the LHD, the local health district, which is a fantastic coup. But we also know that the LHD only provides about 1/3 of the vaccine to our community. So we've also got a huge amount of vaccine supply coming online through GPs and pharmacies, and that's only going to increase once Moderna hits the region. So the ask, this is the ask. We've all seen this image at some stage during the pandemic. This is the multiplier effect. This is what happens if you contract COVID and how you can spread it and share it. And this is why we see the numbers growing within our region and sadly in other regions across the state. Back to the Illawarra, we've dropped the rock in the pond in terms of strengthening community action. We've put it there and there's a ripple going out. But we need you to get involved. We need this to be like a torrential storm of raindrops in the pond so that all of our spheres of influence are connecting with different parts of the community, because we can't just rely on one body or one message going out to engage everyone. We need to be doing this. And I think that no better example of that is our loved ones, the older members of our community or people who are disconnected that don't have access to internet. They can't jump on vaccineIllawarra.com. They don't have access to get themselves into a private transport to get to a vaccine treatment. My request here, in addition to getting involved with the Vaccine Illawarra campaign online, is make that phone call to those older people in your community, in your lives. Make that call or contact to people that may be disconnected. Support them by making those bookings for them, assisting them to get that transport that they need to get their vaccine. Because if we are true to our sense of community and our sense of connectedness, we all have a role to play for supporting those that are more disadvantaged than we are.
Toby.
Yes, Kelly?
Isn't it true? And this kind of goes to the whole vaccine hesitancy thing. You told me that cab charge issued statewide, was it like $200,000 in vouchers to assist those who didn't have, transport to get to their vaccine hub or what have you. And it went in, 24 hours, 48 hours?
Yeah, they announced that, I think it was on Monday, and by Wednesday it was all taken up. And that just goes to show the amount of interest and desire of people to get their vaccine. They just don't have the means to get there. So I think it's a huge, just to that point, Kelly, it's a huge opportunity for us as a community to rally together and try and help people get there.
Yeah, correct.
We're also hoping that cab charge will top that up. Apparently it was through a philanthropic grant, so we're hoping that there's going to be another generous philanthropist out there that can help do this. So in the interest of where we're at, we want to be the first region to vax to 80%, not just in New South Wales, but in Australia. We believe that we can do it. We've seen the Illawarra rally behind many different campaigns. So we thank you in anticipation for joining us. But how you do that, quite simply, here is your job. Like and follow us on Facebook, which is 80% Illawarra. The Facebook censorship rules wouldn't allow us to use Vax the Illawarra. They're anti anything using the word Vax. But interestingly, on Instagram, which is owned by the same parent company, would allow us to have Vax the Illawarra. So if you jump onto Instagram, follow Vax the Illawarra, use Vax the Illawarra hashtag on your own videos, photos, or content. So if you're going to the Mass Hub or you're going to your GP or your pharmacist, you get your vaccine. A lot of people are sharing that their one dose or their second dose. Put Vax the Illawarra on your posts. When you do that, the Vax the Illawarra social team will like and reshare it, and we'll just spread that message of more people just getting involved in it. Because a lot of the hesitancy will be countered when people see people that they know or people that they respect or individuals that they trust getting their vaccine. So that's why it's so important that you do your job to sharing this message, because now's the time to strengthen community action. And it's also the time, knowing that we've got the supply, that we mobilise the community to vax the Illawarra. So thank you very much, Kelly, for that opportunity. Thank you, Chappo, for keeping time. I hope I've met the measure all right.
Well, Renee, there is no rules here, so.
I might just Sorry,
Yeah.
Chappo, I just put that in. I think that's a really good point that you just made about people seeing people that they relate to, people that look like them and do their sort of stuff, because it kind of, you know, kind of just supports that swell of a social norm that this is kind of the thing to do, just like we, you know, put litter in a bin or line up for a bus. This is kind of what the community is going to do to get us through. And I just wanted to take back a step to frame the conversation, because we promoted the chat as a public health approach. So we're all from public health. We understand what we mean. And this is kind of more of a colourful version of Toby's Ottawa Charter. But just to clarify for anyone who might be not, you know, understanding, the public health approach that we are talking about is really looking at the health of the entire population. So we look at prevention, whereas the medical model looks at treatment, you know, of the individual with diagnosis and treatment. So that's just to kind of outline the kind of big picture of what we're about. Now, Chappo, sorry.
Can I jump in?
Yeah.
So I guess a brief intro for myself is that I'm currently working in the Ministry of Health. There's a lot happening in the pandemic response at the moment, and a lot that probably the public will never have to understand, which is kind of a good thing, that not every aspect of a pandemic response needs to be on a community level as well. But understanding that there are thousands of people working around the clock behind the scenes to understand what this virus is and how we get out of this situation. And I guess on Kelly's point there, that public health approaches and preventative health have been around for hundreds of years. This concept isn't new to public health professionals. It may just be new to some people that are quite concerned about what's happening and the fact that it's happening so fast. And to touch on Toby's point, in regards to the ripple effects and public health preventative measures, just to put everything into context at the moment, because you know, there are debates floating around in regards to, well, why should I get the vaccine, etc. It's not necessarily always about the individual, and we'll probably cover a lot of that in the coming questions. But just for clarity around our situation, the first case in New South Wales for Delta was around the 16th of June. That was 12 weeks ago. He didn't pass away from that. You know, unsure about his adverse effects, but he's still fine out in the community at the moment. We currently now have close to 50,000 cases, and I think at last look, 219 deaths just from the Delta outbreak in 12 weeks. So you can see why public health measures and the need to understand the severity of this virus is really crucial, not just for individual health, but for public health, which is what Kelly touched on. And we are at that stage now where we need to be educating the community. I mean, public health professionals would have loved that to happen 6 months ago, so that by the time Delta did hit us, that we had a lot more community involvement in regards to we're all in this together. But yeah, hopefully this does provide a lot of clarity around some questions that people have from a public health approach. We'll dive into some questions that people have asked and kind of bounce off each other a little bit. If this does resonate with you in regards to this webinar, this is recorded, so feel free to grab the link at the end of it. If you feel like other family members or friends will resonate with this, flick it through to them. This isn't, you know, it's not about digging trenches in on either side of the debate, which is kind of where we see ourselves at the moment. It's around clarity of the virus, where we currently sit and how we get out of this situation. So I guess I'll throw to Toby, I think, for our first question. And we'll see where we go with this.
Thanks, Chappo. No pressure. And I think just before I open up question number one, we've all been doing public health for quite a while. We've studied it, you know the academics of it, worked in the field. We're trying to be practical today. So we're going to try and steer clear of stats and numbers and anything too hardcore. So I'll, which will be easy for me, but Chappo and Kelly, I'll keep you guys in check. All right, question number one. So we've actually got questions here. What's the validity of the conspiracy theories or the anti-movement with respect to COVID-19? Right, there's a good one. Look, I think if conspiracy theories, I'm going to break that into two parts. You've got the conspiracy theories piece and you've got the anti-movement. I think let's tackle conspiracy theories first. The challenge with conspiracy theories is they have always got an element of truth, sufficient enough that people can hang on to them. So if you look at where the conspiracy theories have been through the pandemic at the moment, one is that it's bio warfare, designed by the Chinese government, leaked from a lab, versus it's actually a disease that's jumped from an animal into the human body. Now, if you look at the existence and the history of SARS virus, that's actually been proven to be how these viruses transmit and come to life. But unfortunately, the conspiracy theorists are using the Chinese lab theory to try and create some, I'm going to say, anti-Chinese sentiment. And unfortunately, we took a little bit of time to change the name, change a lot of the names around different variants of COVID or the coronavirus, COVID-19, to Alpha and through to Delta rather than the countries that they did. So that actually supported some of that anti-nationality sentiment for different countries. So I think the conspiracy theorists have got elements of truth, so there is some validity, but the theories themselves aren't valid when you look at them in totality and in detail. Then I think the next part of that question, which is around the anti-movement, what I see as the big challenge for the anti-movement, and it's the big challenge for those who aren't a part of the anti-movement, is that it's a number of different antis that have actually become one. They've become a homogenous group of anti-ists. Not that that's a word, but you know what I'm saying. The anti-mask wearers, I completely understand why you're doing that. That's fine. If you don't want to wear a mask, that's perfectly okay, but stay at home. If you're anti-vax, perfectly fine. That's understandable. It's not the philosophy that I follow. I believe in the advancements of medical science and modern medicine, and I know that vaccines work, so it's not my view. But if you're anti-vax, again, that's fine. In the current conditions, stay home. Then we've got the anti-lockdown people that are just sick of the lockdown. They want to get out and about. Well, that's fine. Be anti-lockdown, but do it in a way that's supportive of the community and society, and wear your mask, exercise as much as you want, and you'll be almost as fit as Chappo. But also, importantly, go and get your vaccine. Fitter. So I think that's the challenge I see with the conspiracy and anti-movements.
Just on that note, in regards to I think sometimes the argument is all wrapped up into one big ball where the answer to these questions aren't black and white. There's a lot of complexities that are happening in this space at the moment, and potentially for anti-lockdown, I get it. It sucks. No one enjoys having lockdowns, but they work, and hopefully we go into that a little bit later on. But the sentiment around there is probably more to do with economic support. If people had economic support throughout lockdown, there may not be that anti-lockdown sentiment. So sometimes, as you said, there's a lot of truth in some of those pieces. It's just potentially where you need to unpack those. And I guess I think a big thing at the moment is the thing that I hate about COVID is the fact that it's driving a wedge between families and friends, and we're forced to have all these big scientific conversations where we may not know it either, and we're just trying to protect ourselves and our family. But firstly, to understand, you don't need to get into those conversations if you don't want to. If that's stressful or creates anxiety, in friendship groups or families, that's completely fine. Say, I'm not comfortable talking about this at the moment. That's completely fine. Two, I guess understanding where people come from is always a really good starting point. You don't want to create this, back and forth business. You need to meet people on their page and understand that, these are really tough times. And then I guess trying not to get too bogged down in detail. As I said, we're not all epidemiologists, and nor should we have to provide every single piece of detail. But there's a thing called Gish Gallop, and it's a weird phrase, but it's the concept of when someone comes to an argument or a debate and just brings every single element of what's happening into one space. So don't get too bogged down into that. Understand what the question is, and try and unpack that question potentially. But I think the biggest thing when we're talking to friends or family is just to not tell them. No one likes to be told they're wrong. So just planting a seed in regards to letting them understand their own critical thinking, if they are a critical thinker, to say, oh, well, what about this, or what about this, and leave it with them. You're not gonna change people's opinions or minds in a 5-minute conversation. So
or a Facebook post and interaction, it's impossible. Yeah. And I think, the conspiracists, they use fear, and fear is extremely, powerful. It's extremely explosive. And I was thinking, we've all sort of traveled in our 20s and gone to these, amazing countries, and we had to sign that we've had a yellow fever vaccination. Yeah. So even just, just kind of bringing these little things into people's mind, just to sort of say, look, vaccines are there, they work, that they're there for a reason, and like Toby said, it's about sort of public safety. So, no one's, holding a gun to your head to wear a face mask, although the police will question you because that's a public health order at the moment. But there are laws for public safety, and I think that's the thing that's been really kind of hard to communicate when it's gone so rapidly and it's changed every other day. But I think, unpacking the reasons why somebody might be hesitant for any reason, it might be religious or just is kind of what we need to do a little bit more sensitively. Yeah.
And in regards to those public health measures, I think it would be much easier for people to see the effects if it was visible. If COVID-19 literally turned up as a visible thing onto our shores, people would be very open to say, oh, let's defeat this thing. That's completely fine. The fact that it's invisible is really tricky, but touching on your point, Kelly, like for certain things, we don't question certain measures to keep us safe. So for instance, a security screening point at a airport to make sure you don't bring a gun onto the plane. I guess in regards to vaccinations, that's the screening point, and public health measures are the screening point. And then I guess the vaccination of a population is kind of taking the bullets out of the gun. So we've got, like, it's easy to see it from certain point of view, but it's tricky for us to when we're seeing it happen live and so quickly, and yeah, when it's an invisible invader, I guess.
Yeah.
I think just one final one on that is as well. There's I said we'd stay away from anything too academic, but there's this thing called social identity theory, and you see it play out in sports clubs that you follow, or performing arts that you enjoy watching, or book clubs that you like participating in many different things, even in friends you connect with. It's like-minded people sharing like-minded values, ideologies, ideas. We're seeing these conspiracy theories, and back to the us and them that we're seeing play out, it's social identity theory in action. People are connecting to something because it resonates with them. The challenge for us as public health people and, people in the community that support and want to end where we're at the moment is trying to break down that social identity to something that just factually isn't correct. And it's really difficult when you're getting those conversations like Chappo was just mentioning, to break all of that down, because it's an emotional response. When people are emotional, it counteracts rationality. So what you need to do is to, like Chappo said, leave it with them. Here is the fact, here's the knowledge, here's the evidence. Because in a lot of these conspiracy theories and these anti-movement sort of conversations, there's not a lot of the evidence. Evidence is key. The evidence isn't there to back up what they're saying. There's opinion pieces, there's articles galore, there's lots of social media commentary, but it's not evidence-based. And all of the decisions that are being made and being put into place in this comprehensive public health approach are based on evidence, fact, and knowledge.
And risk too, I suppose. You've got to weigh at the risk. Anyway, who's got another question? Chappo.
I'll ask the next one. So I guess we kind of touched on this, but what do you think about the New South Wales lockdown measures? Did they work, and are they currently working? Anyone else want to start on that one?
Well, they are working. I think, they've had to be completely necessary. Like the virus gets transmitted so rapidly, it's through the movement of people. And so to immobilise the movement of people is probably the strongest tool that, the government had at hand to limit that. And I can understand that, that went straight to people's sense of, civic freedom, and that's really kind of fueled a lot of the tension and the divide. But, I'm not a statistician, as we've established, all that modelling is kind of for the modelers to do. But I know that it has worked because the projections for if we hadn't have done what, and then, like Gladys has said, there's always going to be argument of going, too early, too late, hard, fast. But they've definitely worked to reduce the mobility and therefore the spread. What are you hearing on the inside?
Yeah, so I will touch on the modelling, and I guess we need a little buzzer every time someone goes into stats. So
yeah.
myself and Toby, I guess. But anyway, the Burnett Institute actually came out with modelling last week that suggested, and this is huge, that the lockdown measures, along with increases in vaccination rates, have prevented roughly 580,000 cases and 5,800 deaths just in LGAs of concern, the 12 LGAs in Sydney of concern. So again, touching on what we spoke about before, what Kelly brought up, that like preventative health is super hard to see day to day. We can see it in, smoking rates 10, 20 years down the track when we were like, oh, that worked.
Yeah.
As it happens, it's really tricky to understand when nothing is, we can't see it. We can't see the outcome of that. So it definitely does work. And until we get to a certain vaccination rate, that is our only option to reduce people coming from overseas, to do contact tracing, and to limit people's movement. And Delta is just a fierce competitor that we needed to, shuffle the playing board a little bit.
Yeah, I remember last year, this is before Delta, and Norman Swan said in some interview, prevention works when you can't see it. And it just kind of wraps up that whole frustration that we have in this space, because we're always, it's beds in hospitals, and, the ratio of nurse to patient, and all that's really important. But the prevention and all this stuff around public policy and, creating environments and personal skills keeps people out of hospital. So prevention is better than cure. We're just, unfortunately, it's always kind of been that more marginalised sort of area. But the more we can keep people out of hospital, the better. And we know how to do it. It's just sometimes it's not that sexy to get the funding. It's physical activity and good health and clean water, and it's often butting up against crisis, which is what we're in now, or a natural disaster that it's kind of to cut through to maintain the rage in the prevention space is kind of what we deal with all the time. But yeah, no, you're and those figures that you gave, were they just in this 12-week outbreak?
Yeah, that's since Delta. So if we let it, there's something called an R value. Again, someone buzz me because I'm using numbers.
No idea.
The R value of Delta at the moment is anywhere between 5 and 9, which means that if I have it, I can give it to, without any public health measures at all, I can give it to roughly 5 to 9 people. Those 5 to 9 people can then give it on again. That's an R value. We kept it in New South Wales Delta. I know it went crazy, but our R value was 1.3. Like those public health measures,
wow,
100% worked. And you only need to look to India to understand when healthcare systems aren't in place, it just goes rampant.
And I think it's good to see it as a package as well. Like it might seem a bit overwhelming with, do this, that, and the other, but, if you like a slip, slop, slap, and wrap, that were 4 different behaviours that you could do to prevent yourself getting skin cancer in the long term. So, and we're not going to get out of that soon. You know, we're still going to have to, even when you're vaccinated, you're still going to have to wear a mask in high risk situations or environments, you know, like public transport or whatever. We're still going to have to protect our kids and the elderly, you know, so it's the package of public health measures that when they combine is the effective, you know, from a, you know, community level.
Yeah, and a good analogy there in regards to the vaccine, like a lot of that anti sentiment is around, oh, it's not 100% effective. No one has said that it is 100% effective. It's going to reduce severity, the possibility of passing it on, hospitalizations, ICUs, and deaths. I always relate it to it's like putting on a bulletproof vest. You know, if someone's shooting at you, you know, you're probably going to understand that it's not going to save your life, but you'd still put one on. And that's kind of where we sit with a vaccination.
Yeah. Okay.
Next.
All right. Is it safe to get vaccinated when pregnant or breastfeeding? So the simple answer is yes. And I think that, you know, the government put out lots of you know, documents that outline the evidence for it. So, I mean, again, I'm not a doctor, but I do know that the ones for pregnancy and breastfeeding are Pfizer and Moderna. I don't think the studies have been done with AstraZeneca, so that's the reason why Astra isn't recommended for breastfeeding and pregnancy. Just like the general population, the 2 doses at any stage in pregnancy is better than 1. And there's also some evidence to suggest that, you know, the antibodies that the mother produces with the vaccination can be carried through the placenta to the newborn and also through breastfeeding as well. So I don't know if anyone else have I missed anything? I think, I mean, yeah, I mean, there's probably some angst because it's new, but I think the newness, it's not really around the safety or the efficacy of the vaccine. I think some of that gets confused with the length of time we remain immune after we've had the vaccine. That bit's unknown. That bit's, you know, in a year or two's time, we will know those things. But the rigor that, you know, these have to go through before it even gets to a human trial is pretty, you know, robust.
I think that as well links in though, Kel, to a lot of concern or angst around the vaccine was because it was done, you know, brought to market so quickly, market being into the arms of consumers, being all of us chasing down a vaccine. So the reason why that was able to happen was firstly that this isn't the first coronavirus we've ever had. This is the coronavirus that was in 2019, hence COVID disease 19. So what happened with previous coronaviruses was that they're actually able to build responses, medical responses to that. So what we're seeing, COVID-19 is an iteration of previous coronaviruses, and the vaccine that we've got is an iteration of previous medical responses to coronaviruses. That's why it was able to able to be put into arms as quickly as it was. People have got this whole, I guess, misconception that it was a brand new vaccine that's completely fast-tracked or any sense of randomized controlled trial to be put into arms, but it wasn't. It's actually an iteration. They were able to use a lot of that pre-existing knowledge because it was transferable under these new disease conditions. And that's why there's such high confidence levels around the safety and efficacy of administering this vaccine to pregnant women, breastfeeding women, and even women that are trying to be pregnant.
Yeah.
And just touching on that, just in regards to both that vulnerable group, I guess, and also wider, is that we're actually, as humans, we're really terrible at understanding relative risk. When we see a number, if it's too large, we just go, oh, well, there is a risk there, so we won't take it. There's a great campaign called the Vaccination, which it's just a funny look at the relative risk of something, which shows that for AstraZeneca is 1 in 100,000. What is it? I think it's 1 in a million for the AstraZeneca jab to get any adverse effects. And then it plays that off to something like exercise, which is 1 in 13,000 that you're going to have something happen during exercise. So it's just putting it into perspective, and the risks or the issues that come with COVID-19, especially say as a pregnant woman, is worse than having the actual vaccine itself.
or the disease.
Exactly.
I
Yeah.
think that's the thing too, that people kind of lose sight of the risk, cost benefit of having the prevention, the vaccine with getting the illness.
Yeah,
I mean,
exactly.
put 1 million people out at JJ Kelly Park and infected one of them, and they're all unvaccinated, the likelihood of that spreading throughout the whole of JJ Kelly Park is pretty, high. Whereas, if you gave them a vaccine, then obviously, that risk reduces. So, interesting. What about men? What about guys?
Yeah.
Have you heard anything like in terms of? I think there's sterility, there's issues, there's virality,
sorry, I can't help myself, but this is too easy a pun to take. But this is a really hard question. But there is actually evidence. So one of the big things out there at the moment, similar to the male version of the breastfeeding and pregnancy misconception, is that the COVID vaccine will have impacts on your sterility, on your penile erections, and also on the ability for your testes to work the way they are. That is completely untrue. What we do know is that from the survey, the research that has taken place, they've actually found in the biopsies from people that have died, some from COVID, is that the disease has remained in the muscular tissue of both the testes and the penis for months after people have been unwell with COVID-19 or after they've died. So what we know is as well that with erections, that's actually been impacted because the way that COVID would have limited the blood flow to the penis. And blood flow to the penis is fundamentally important for erections. It also, because of that reduced blood flow, that's likely to cause the lower sperm counts that they're also finding in men that have had COVID. But in any of those tests that they've done, and again, the sample size isn't massive at the moment because it's still iterating through, but in any of those tests that they've done, they've not found any traces of the vaccine in the tissues of the penis or the testes. So what that goes to show is that there's a big piece of misinformation out here. We've got evidence to counter it that very clearly proves that COVID-19 lives on whilst the vaccine does what it's meant to and then is just part of the normal function of the human body.
And we've got to understand there that, touching on your point, that research is evolving, and the more we get into this, the more we will understand. But there's been 5.8 billion doses administered around the world, and nothing at this point to suggest that those kind of outcomes, which is good. But I mean, unless you're listening to Nicki Minaj as your health as your health advice, I don't know if anyone's seen her tweet lately, but. Yeah, it's worth a bit of a look. That sent the poor Trinidad and Tobago health administrators off to try and figure out what she was on about in regards to someone that had an adverse effect in their testes. And it's like, we shouldn't need to be, it's just a bizarre world we live in where public health professionals are trying to chase up what someone like me said on the topic.
What's it called? The infodemic. We've got way too much information, and people will, as we've discussed before, people go looking for the meaning that kind of makes sense to them, that kind of makes them feel safe and so forth.
And it's all linked into the uncertainty. It's people are looking for some affirmation, it's confirmation bias, not trying to get too, but I believe this, I'm going to find some information that supports that, then I feel safer and comfortable that I know what's going on.
And I think that's why this sort of chat's really good, or we could just maybe, support people just to, not get bogged down in numbers and politics and divisive things, but just, have the conversation, acknowledge the angst and different opinions, but just, leave the seed of truth, I suppose. I've got one more. How many do you?
I think I got one as well, but you go, Kelly.
You go, Kel.
What do you think about the comments about needing to live with COVID just like we live with the flu? Okay.
Yeah.
We've got politicians to kind of blame for this in a way, because I think it was the Prime Minister that said like the flu. And then obviously our Premier's constantly talking about needing to live with COVID. And I don't think it is, it's dangerous to think that it's going to be like the flu. Like nobody disputes that it's not the flu. It is far worse than the flu. And that's probably something that probably maybe hasn't been enforced as much as what it should be, because obviously it's, if you've got flu-like symptoms. So it's kind of, the messaging is, if you've got flu-like symptoms and the flu is kind of perceived as to be this thing that you can catch, you can, get sick, you might get better. But I mean, I think there's two parts. I think in this interim thing, we will have to learn to live with it, like we've discussed with all these different public health measures. But once vaccination rates get up, and once, contact tracers have got less people to trace, we need to be thinking about it much more as something we need to get rid of, not something we can learn to live with, like measles or polio. We've got that's the objective, is to get rid of it completely. So I think it's dangerous to think that it's just, we can live with it like we live with the flu. That's just not true.
And I guess in regards to where we sit with it at the moment, it's gone from a epidemic, which is in a certain location, to a pandemic, which is worldwide now. And now it has the threat of being being endemic, which means that it kind of still circulates within the community. And I would say, I agree with you, Kelly, literally the only time that I would relate it to the flu is in the fact that now we're at the risk of it being endemic, where it's continuously circling around in our community. And the worst part is that it will circulate in unvaccinated communities, and especially those communities of vulnerable population groups. So culturally and linguistically diverse, our poor Aboriginal and Torres Strait Islanders, which are already overrepresented in COVID cases based on their percentage of population in our society. So that's who we need to protect in this, and it's not about me or you. It's about our vulnerable population group.
I think one thing I'd like to add on that as well is that the flu is seasonal. We know that there's flu season coming up. We hear that every year. We know when to get the vaccines and whatnot. This isn't a disease that's seasonal. We've seen that it runs, or it's prevalent year round, if we don't have the right counteractions in place, which is why we've got all of those measures that we've already touched on. And I'd also like to take the opportunity just to smash another myth that we hear out there a lot at the moment, which is, but the death rate to COVID is no different to the flu. That is complete and utter absolute codswallop. What we're seeing at the moment is a death rate from COVID that has a similarity in terms of a metric or a number to what the flu death rate is. But what we know there is that the death rate from flu that hits that number is in relatively uncontrolled environments, relatively uncontrolled situations where we accept and acknowledge it's going to come on. If we've got a disease being COVID-19, which is hitting that same metric under these harsh conditions around protecting people and protecting the spread and minimising it, that's hitting that, I would hate to imagine what that number would shoot to if we were to let it participate in community and society without controls like we've got. So it is not like the flu. It is not seasonal. The death rate is far more staggering if we were going to let it participate in the same manner.
The other thing is, and I'm just conscious we've got 10 minutes left, but the other thing to note is that we don't know the longer term effects of COVID, the disease. And so that what they've studied in, those that have recovered from an acute illness with COVID don't necessarily return to their full bill of health afterwards. So they're still, for months, or, we don't know how much longer they'll be short of breath, the fatigue, and that's referred to as long COVID. So the flu doesn't necessarily have, an impact after you've had it for years on end. And it, increases the risk of more people living with chronic disease. And I mean, ask anyone with asthma what it's like to live with asthma. I mean, my God, that's a debilitating, you cannot breathe. So I think that's the other thing, the difference with flu is that, the long COVID, we don't understand, and that poses a real risk for people's quality of life and their health, after their, real illness with the COVID.
And I think just on that, if rather than the academic version of long haul COVID, if you want to jump onto vaccillawarra.com.au, there's some videos there of Henry Carpick and Don Jones, 2 retired police officers that were on the Ruby Princess last year. Both ended up in hospital from COVID. Henry was actually in the intensive care unit on ventilation for quite some time. But both of those men now speak to the fact that they still don't have, like Henry can't hold coins in his hand anymore. Their ability to exercise is significantly reduced from before that. So there's some really human examples of what long COVID is doing to 2 previously fit and healthy men.
And I think actually I've just, this is not a COVID thing, but I think it's actually just to pinpoint like behaviour change really works in terms of prevention, because even if you look at the flu rates, they've gone right down. It's because everyone's learned to, sneeze into their elbow, stay at home if they're feeling sick rather than go to work and spread it to everybody. Yeah. And the flu rates are way down. And yeah. I don't know, maybe we've gotten rid of a few strains of flu in this process unknowingly. I mean, it's possible, but I just, in terms of, behaviour, flu's, I don't know the stats, but I do know it's like probably tens of thousands less than the last flu season.
Yeah. I do love that it's taken a pandemic to teach people how to cover their mouth when they sneeze and wash their hands.
Should I end with one more?
Yeah, go for it.
All right. Okay, so I actually encourage anyone to type into the chat box here as well.
There's a couple. Yeah.
But what has been one of the weirdest pieces of misinformation that you've heard? I guess we've covered some of this. I guess I'll jump in. There's 2 that I really want to touch on, which kind of can be debunked in one setting. So firstly, the Bill Gates is trying to microchip us. I really feel for the guy. He's been prolific in trying to reduce the rates of Ebola in African nations to the point it was almost eradicated. The poor guy has literally funded so much research in that space, and to get this kind of opinion piece around that is bizarre and unfair. And the second one is the whole COVID-19 and 5G business. And on that, it's that one there is in regards to correlation versus causation. So 2 things have happened at the exact same time. COVID has hit and 5G has become an option for our telecommunication. Those 2 things have happened at the exact same time. They don't cause each other, one or the other. And the best way to describe that is it's like saying that ice creams cause sunburn. Ice creams cause sunburn. It's a really weird thing to say, but that is a correlation. Those 2 things happen at the same time. The cause is the sun itself. And because you're out in hot weather more often when you're having ice creams, that's when the sun's out, and that's how we get sunburn, not the ice cream itself. So correlation versus causation is really crucial to unpack those kind of misinformation pieces.
Love the 5G one. And just to completely counter it, the day I got my second vaccine, I came home and our internet crashed. So our internet crashed and we're out for 2 days. So clearly it's not in my blood at the moment. Linking to the Bill Gates one of the biggest pieces of misinformation that I find fascinating, and it's a rabbit hole that if you've got strong will and you've got good resolve, go exploring because it's fascinating. But it's this whole it's the whole theory, this eugenicists. So there's a theory out there around the eugenicists, which is essentially that rich white people have been controlling the makeup of society for generations, and now these eugenicists have actually planted this to eradicate a whole heap of the population so that they can gather back control. It's just, the mind boggles how a naturally occurring disease that's jumped from animal to human and has now gone rampant is actually being blamed on the big rich white guys of the world, which links into Bill Gates, because I think he might be a eugenicist, allegedly.
There you go.
I can't really add to that. I can't get past Trump with this disinfectant directly through his IV. That was.
I mean, if you don't laugh,
the weirdest one for me. We've just got. We can wrap up. I'd just really like to thank you guys for your time and your expertise, and your ability to kind of make this a little bit more digestible on a Friday afternoon. Might just go to there's a couple of little questions on the inside. I'm not sure, Kylie, the vax rates. Toby, do you know for our area?
I can tell you, if you look at the Vaxometer on vaxillawarra.com.au, you can see they've actually transferred all the data from a New South Wales health site. It goes into a lovely looking thermometer type bar. We're at 49% fully vaccinated. So we're quite a way along the journey, but we've obviously got some more work to do. So encourage your friends and family to go and book in, because we get double the supply from Monday the 20th. Get in there.
Yeah. Kath's asked about the COVID hotline. So what happens when people are positive and then they, well, actually, Toby, I don't know if you have insight into this as well, but I know she's asked about food assistance, and we know that food security and access to food is obviously pretty impossible when you're forced to stay at home. So there is a system where, they are looked after by health and packages do get to them. But what we do know in our region, the cases are climbing, and just learning from Southwestern and Western Sydney, it will ramp up. So Kath, we are aware that in the next couple of weeks, that needs a little bit more attention to make sure people do get their boxes of food. There is a system, it needs to kind of have some more manpower and kind of coordination, but it's hard.
And I can tell you, Kath, so we were fortunate enough to be advised by the New South Wales Health contact tracing teams that we were close contacts here in my household, did the 2 weeks in isolation. They do check up on you to make sure that you're okay and that you do have access to food with telephone calls. Similarly, when the police were doing their compliance checks to make sure that we're at home, they were checking in. They are actually welfare checks as well to see if you need any of those bare essentials. We're extremely fortunate to have family and friends also checking in on us. So I would encourage you, if you do know of anyone that is isolating, just reach out. It means the world to have a random food parcel dropped on your front door. So let's think about our role as good community people.
Yeah. Tips for local businesses on navigating reopening.
Yeah, I'll touch on that. Just our team here, or my team, looks after the public health orders, which continuously get updated based on new health advice or the way that we're coming out of this. So that is constantly evolving. My best tip is to keep an eye on both the New South Wales government and New South Wales health websites, because between the public health orders as well as the guidance around businesses reopening, there should be up-to-date information every single day in regards to how that looks. I think we do have a really tough time coming out of this with the vaccinated and unvaccinated, and I mean that's going to be hard for businesses, but hopefully they can lean on the public health orders to reopen their business, be safe in doing so, and so that we don't have to have this us versus them mentality, and that we can all get along. It's a time where we just need to be nice to each other. We've kind of forgotten a little bit about that in COVID time. So if we can get back to that as we reopen, I think we'll get through.
Thanks, guys.
Thank you. Thanks
everyone.
Thanks everyone out there. Have a good weekend.
It's been awesome. Happy Friday.